Persnickety, it's an ornery piece.
Persnickety,
Okay,
what
it
a
is.
good word.
It is.
So,
Yes, indeed. So Dawes is...
Disc-associated wobblers syndrome. So a lot of our large breed dogs can get a vertebral abnormality called wobbler syndrome, where the vertebral bodies, the actual bones themselves, move a little bit more than they should. And Mother Nature doesn't like that. So what happens is Mother Nature puts scar tissue around the joints to try to solidify things. The joints of the bone live right outside the spinal cord. And so if those bones are enlarging and they're thickening and they're trying to solidify, the spinal cord gets compressed slowly over time. And uniquely, the spinal cord, the cells that live inside, there are two different areas called the gray matter and the white matter tracts. The gray matter tracts come from the very inside, and they come down locally to the front legs. The white matter tracts travel all the way down to your pelvic limbs. And so if there's going to be something compressing from the outside, the pelvic limb pathways get affected first. So usually I see the back legs are one grade worse than the front. So knowing that there's weakness in all four, but there's more weakness in the pelvic limbs, this makes a lot of sense. And then, and I guess you could just have wobblers. That'll be our number 2. Some of our dogs with this disc-associated wobblers will rupture a disc on top of it. So you have this chronic spinal cord compression that's there that we're dealing with, that we're compensating for. We cause some orthopedic injuries over time because my front legs aren't perfect. And then I move the wrong way at the wrong time, and a disc, which is between each of the bones of our back and neck, herniates out, presses in your spinal cord, and you are worse pretty quickly. Most common thing I see. Now, Great Pyrenees are unique. They get a lot of other things too. There can be fluid pockets inside the spinal cord or outside the spinal cord. Something called syringomyelia, or what's called a subarachnoid diverticulum. They're just both, the normal spinal fluid pathways aren't traveling the way that they're supposed to, either from inflammation, a congenital malformation, scar tissue, or even Wobbler's disease. This instability can bump on the spinal cord, cause scar tissue to form in the pathway of fluid, and now it's like putting a stopper in the bottom of the sink. The fluid can't get by, and so it backs up. As the fluid accumulates, it impedes the flow of signals as they're traveling from your legs up to your head. And the same thing, the outside, where that fluid pathway is, gets affected first. Then the front legs become affected longer term. Great Pyrenees, any giant breed dog, not really giant, medium to giant, can have tumors and cancers at early ages. And I hate when they happen. But I've had 4-month-old dogs with spinal tumors. Oh, wow. And it stinks more than anything. But Mother Nature is dumb and she does what she wants to. So it's definitely possible. And you can get a tumor anywhere. From the spinal cord itself, from the covering around, from the nerves, the blood vessels, the bone, the connective tissue, the fat around the spinal cord, muscle, ligaments, tendons, any tissue in your body can grow haphazardly. Possible. There's also and I don't think it's too fast, but there is a degenerative spinal cord disease we see in Great Pyrenees called, we see it in a lot of species actually, Lou Gehrig's disease, or ALS. It's the exact same genetic abnormality that dogs have that people have. It's an inherited disorder. Typically, I don't see clinical signs until you're 6-7 years old. So being 4-ish, but we don't really know. I'm not going to say no. So it's still possible. Hard part about ALS is making a diagnosis. And then, how do you treat it? Even in humans, there's no good therapies. There's things we do to try to slow down the process, but nothing that's going to reverse. What else do we see? Straight up disc herniations. Move the wrong way, not associated with wobblers, not associated with anything else. Yeah, you could rupture a disc, push on your nerves, press on the spinal cord, and lead to weakness. I rarely see, and you don't have the fever. No fever. Infections in the spine are possible. Autoimmune diseases in the spine are possible. Parasites migrating through are possible. Single-celled protozoal organisms are possible. Everything else is possible. But there's kind of my list. So we'll say disc, right tumor down here, and then other, everything else. Now here's the hard part. Which one do you have? Which one do you not have? How do we find it? What do we do with it? So in our dogs, there are a few different tests we can talk about doing to try to get to the answer of what is happening inside their body. The best one I have in a puppy who can't talk to me and tell me what they feel, same one we do for us, is would I MRI your spine? Starting with your neck, and if I don't see anything, potentially going back towards your thoracic spine. Because that weakness in the front, I think, is real, but is it just we're so placid that I'm just going to leave my feet there a little bit longer? But there's enough discomfort in the neck that that's where I would focus my energies. And I can't just take whole body pictures because I'm looking for structures that are really tiny. And it's like taking a landscape shot. You can't see the individual leaves on the trees. I want to focus in and take just that tree. And so we look at your neck, don't see anything, then we're moving. But if I have your problem, I know exactly what there is, great. I can find vertebral abnormalities, this wobbler's disease. I can see disc herniations. I can see discs associated with wobblers. I can find fluid pockets inside the spinal cord. I can see fluid pockets outside the spinal cord. I can see most tumors and cancers. I can see evidence of infection, evidence of autoimmune disorders. Degenerative spine diseases, I don't see a darn thing. Completely normal. And that's just because that degeneration is happening on a microscopic level. MRI can only show me things that are actively there at the time I take the picture. So if there was a problem and now it's moved on or healed, I don't get to see it. And those problems have to be 1 millimeter or bigger. So almost everything I can find, it's just those cellular changes that I can't. And that even goes back to tumors, cancers, infections, and autoimmune disorders. If there's a mass, I can say with high certainty, it's this kind. But because I can't see those individual cells without taking a biopsy, it's impossible to tell you definitively what type it is. Infections, which I think are exceptionally unlikely, I can't say is it staph, strep, E. coli, pseudomonas, fungus, who's there because I can't see those cells. There's more tests we do to try to get that answer. But imaging gives you a lot of information. Still could find absolutely nothing. Then I'm backing myself into you don't have A, B, C, D, E, F, G, H, I, J, K. Now I'm back with ALS. The other downside, if you've ever had an MRI or know someone who has, oh, it's so much fun, isn't it?
Yes.
Tiny little tube.
Yes.
Lay on your back. Hold still. Don't move for 35 minutes per region we're looking at.
And listen to the giants pounding around you.
Yeah. And that's all the electrical gradients turning on and off so that we can give radio frequency pulses into the body. And so, unfortunately, it needs to be there.
Yep.
GE just made a machine about 2 years ago that is quieter.
Yeah.
It's a really unique idea that they did. It's how they have stealth helicopters. So where the helicopter is pulsing and the amplitude of the blades pulsing is this way, they also fire off a negative impulse. So it's trying to counterbalance it so it becomes quieter. That's what GE did. And so they have quieter MRIs, but they're not used for veterinary medicine. So humans, yes. They're starting to, but they're also $9 million for the machine. So for human comfort, it works. Only, exactly. But for our dogs, it's the exact same machine, exact same motionless requirement, so we have to use general anesthesia. Anytime I give any drug to any living creature, human or veterinary, there's always a risk of an adverse reaction to the medications. We monitor
even with a past that doesn't show that.
Absolutely. Yeah. So we monitor just how we are in a hospital, keep the same, keep an IV catheter in, run fluids, keep our blood pressures up, and if there's any issues, we can intervene right away. So the number of times I have an issue is infinitesimally small, and I always give that warning. It's always out there.
Do you have an MRI on site here? Oh.
Yeah, not the $9 million brand new one though.
Oh.
It's about 10 years old.
Okay.
It gets beautiful pictures though. Yeah, high field magnet, 1.5 Tesla magnet. That's standard of what's used in human medicine too. Just more sound.
Oh, she started to nap.
I know. She's get relaxed. The question then becomes, what do we do with what you find?
Well, right. What can be achieved? I mean, the zero ground level is pretty weak.
Yeah. So there's a lot of things. It depends on your diagnosis and what our expectations are. Single disc herniation, no wobblers disease. Okay, we could talk about surgically opening up the spine, removing that material, take the pressure off the nervous system, and I'll say 94% of my dogs make excellent recoveries. If there's wobblers disease, bones are unstable, they're growing inwards to try to fuse. Do we fuse your spine together? Stabilize that motion, and over time let those joints that are overgrowing subside. If you have wobblers and a disc, do both. Stabilize and take the material away. Fluid pockets. Okay. Do we talk about surgically removing a scar tissue or some type of occlusion that is leading to fluid backing up, and take that fluid pathway that's compressing that spinal cord and open it up and let it decompress? Fluid pockets are harder on the success rates. Usually about 70% of my dogs make good recoveries, but it still means that the pressure that was there on the spinal cord from fluid and from scar tissue, some of the cells that are inside have already died off.
Yeah.
Nervous system, once the cells are gone, they're gone for good. There's no regeneration that happens. And so our goal is to intervene earlier, because the more cells that are permanently lost, the lower our success rates. If there's a tumor, what should I do? We can talk about surgical debulking, where you take as much away as you can possibly find, although surgery is typically not curative. If there's a tumor anywhere on your body, say I had a tumor on my arm, I'll take the tumor and a whole lot of normal around it to make sure I get all the cells that are feeding off. Your spinal cord, even in a puppy this big, is about the size of my pen. So if there's a mass that's here, there's no extra that I can take without taking that spinal cord. So there's usually little cells that are left behind that are going to grow back. There's options of radiation therapy, just like we can have. You blast an area with energy trying to damage those cells. Most of our spinal tumors do not respond to chemotherapies, although there are certain subtypes that can. And then there's even experimental trials, or vaccine immunotherapy, where we're taking your own abnormal tumor cells, making a vaccine against it, give it back to you to train your immune system to go attack abnormal cells that are left behind. And then combination therapies. You can use surgery, vaccine, and radiation. Most of my owners don't do those. Most of my owners treat conservatively and palliatively. We keep us as happy as long as I possibly can. If there's nothing, and this is a degenerative spine disease, keeping us as active as I possibly can, going on walks, maintaining good physical activity. We try using acupuncture, laser therapy. There's actually a research study. It's a little biased. It was put on and sponsored and paid for by the company that sells the laser. But they're showing in patients with Lou Gehrig's disease, veterinary, laser therapy can slow down the progression. The problem with the study, one, it was put on by the person who sells the laser. Two, there was never a biopsy confirmation as far as the diagnosis goes. So they had weakness, MRIs were normal. There was an assumption of ALS, but never a true confirmatory diagnosis. And
what were they lasering? The brain? Spine. Oh, the spine.
Yeah.
Okay.
Yeah, the entire back.
Wow.
Yeah.
Okay.
And it's a non-invasive therapy. The only thing it hurts is your pocketbook. It's like, except if there's tumors. Laser can actually make tumors grow faster.
Oh, really?
Because what it does is it
stimulates them.
Yeah, so you're stimulating your cells to produce less inflammatory mediators and more growth factors. And by promoting growth factors, all of your cells will grow, including abnormal ones. Kind of frustrating.
Wow.
But everything's treated very differently, which is really frustrating. The other major downside of MRI for a dog is that most of our dogs don't have insurance cards when they come to see us. Everything we do costs a bunch.
Mhm.
And you just moved here and
Right.
have a house and
Right.
yay.
Yay.
All the things.
All the things that come along with a
Yeah.
new new home.
Oh yeah, all the mold behind the walls.
Well, that actually might be the only problem they don't have. There's been a lot of work
Yeah,
going
a lot of
on,
work.
so
Yeah.
Oh yeah, I'm dealing with that right now too. I'll tell you the story. I love it because this just happened this weekend. Our neighbor put up new drywall in the entire house on the ceiling because he said he had popcorn ceiling and he didn't like looking at it anymore. He did a crap job with it anyway. But I was like, well, it's already a 7.5 foot ceiling. That just took another 3/4 of an inch off of it.
Mhm.
Let me just rip it down. Because I'm going to do it right. If it's popcorn ceiling, I'm just going to scrape off the popcorn, right?
Right.
Whatever. It's all mold and holes and water damage and... Yeah.